The next disease is botulism. Botulism is also a bacterial disease. The bacteria that causes botulism is known as Clostridium botulinum. Clostridium botulinum is in the same genus as Clostridium tetani, the bacteria that causes tetanus. So you will notice a lot of similarities between these two bacteria. Clostridium botulinum is also a gram-positive rod-shaped bacteria. It does form endospores and it is anaerobic. So just like Clostridium tetani, when this bacteria is exposed to oxygen, it's going to be in its endospore form where it is dormant. It really only becomes problematic if this bacteria gets into an anaerobic environment where there's little to no oxygen present. At that point, the bacterium can activate and actually produce a very dangerous neurotoxin. As far as where this bacteria is found, you will typically find it in soil. It also has been found in water as soil residue gets into the water, and it is commonly found in the gastrointestinal tracts of certain animals. So as far as transmission, there are several ways that you can get botulism. There's different forms of botulism. I mean, you could even get it through a skin wound, but the most common way to get botulism is through ingestion of contaminated foods, specifically canned vegetables, green beans, corn, potatoes, asparagus, to name a few. How this would kind of present itself is, let's say someone was picking green beans and their intention was to can those green beans so that they could eat off of them for the year. So they pick the green beans and then they likely would rinse them off to get the soil residue off. But let's assume that not all the soil residue gets off. If there were Clostridium botulinum endospores present in the soil, those endospores would likely be present on the green beans, and if we didn't rinse them thoroughly, they may still be present on the green beans when we start the canning process. So during the canning process, you would put the green beans into a glass jar, seal it, and typically put it into a pressure cooker. In the pressure cooker, you would make sure the temperature would get to 121 degrees Celsius and run it for at least 15 minutes. Assuming that you do run the cycle at the right temperature for the appropriate amount of time, even if the endospores were present, they would be destroyed at that high of heat. So if you do go through the proper steps with the pressure cooker as far as time, temperature, you're going to get rid of anything like viruses, bacteria, and even endospores. But in this situation, let's pretend that the pressure cooker did not reach the right temperature. It was supposed to get to 121 degrees Celsius, but let's say it was defective and it only got to 90 degrees Celsius. Well, if it only warmed up or heated up to 90 degrees Celsius, that would not be hot enough to get rid of the endospores. So the endospores would still be present in the can of green beans once you got it out of the pressure cooker. And the pressure cooker, during that cycle, it is going to remove oxygen from the can. So now the green beans and the Clostridium botulinum endospores are in a jar that has no oxygen, which is an ideal environment for the Clostridium botulinum bacteria. So what's going to happen, those bacteria are going to activate. They actually die, but right before they die, they do release a very dangerous neurotoxin. So in that anaerobic environment that they would activate, die, and then release, as they die, they release this dangerous neurotoxin that affects the body. But that's kind of the background to how it can be transmitted through ingestion of contaminated food like canned vegetables. So the toxin that is released in that anaerobic environment within the can is a toxin known as the botulinum toxin. The botulinum toxin is the most potent toxin known to mankind. It's even more potent than something like rattlesnake venom. And what this toxin does is it essentially causes muscular paralysis. So when you ingest the botulinum toxin, that toxin is going to inhibit your motor neurons from releasing acetylcholine. Typically, our motor neurons would release acetylcholine, and then that would allow our muscles to move. But if the botulinum toxin is inhibiting the release of acetylcholine, then the motor neurons do not know that they're supposed to be moving, and ultimately that leads to paralysis. So the botulinum toxin is going to cause muscular paralysis. It is important to differentiate this from the tetanospasmin toxin. The tetanospasmin toxin in tetanus causes muscle spasms, whereas the botulinum toxin in botulism causes muscular paralysis. They are both neurotoxins that affect the nervous system. They just affect the nervous system in different ways. And unfortunately, with the botulinum toxin, it is odorless and tasteless, so you would not know that you'd be ingesting it, unfortunately. So when the botulinum toxin first gets into your body, initially the paralysis is going to be in the facial region because of the ingestion of the toxin. So initially you would have like blurry vision, droopy eyelids, trouble swallowing, some slurred speech. But then as the toxin spreads throughout the body, eventually the paralysis is going to become systemic. So eventually it'll affect the entire body, all the way down to your ability to breathe. And at that point, that's when it can become fatal. It is also important to note that there is something called infant botulism. For most individuals, children and adults, if you would ingest the Clostridium botulinum endospores, like if you would get a handful of soil and eat it, those endospores are not going to be able to do anything to harm you. They would pass through your gastrointestinal system without any severe complications. And that's because it really doesn't provide that anaerobic environment where they can produce the botulinum toxin, the neurotoxin. And we also have a very cultivated normal flora, normal biota within our gastrointestinal system that could prevent the bacteria from growing should they become active. This is not true with babies. With children under a year of age, their normal biota in their gastrointestinal system is not fully developed yet. So if Clostridium botulinum endospores got into the gastrointestinal system, there is the potential for them to grow in that region. And if that would happen, they can get something called infant botulism, which is basically just botulism in a baby. It would present itself with like a weak sucking ability. They would have potential breathing problems. They would develop something called floppy baby syndrome, where they kind of lose the muscle rigor in things like their arms and legs and back. So for this reason, you should never give a baby under 1 year of age raw honey. Raw honey can contain Clostridium botulinum endospores. Like I said, if a child or an adult ingest it, that's fine. The endospores are likely going to pass through the gastrointestinal system without any complications because of the normal biota that we have. But in babies, that normal biota is not fully developed. So if they would ingest raw honey, Clostridium botulinum endospores might have the space and opportunity then to grow within the gastrointestinal system and lead to infant botulism. So just never give a baby under 1 year of age raw honey. So what is the treatment for botulism? As scary as it sounds, it is something that if you seek treatment right away, it will not progress to something fatal. So if you would eat canned vegetables and then start to experience some facial paralysis, you'd want to go to the hospital right away. And what they are going to do is they are going to administer a botulinum antitoxin. It is basically just antibodies that they will inject you with, and those antibodies would bind to the botulinum toxin and neutralize it. So at that point, once the toxin is neutralized, those motor neurons can start to release acetylcholine again, and the muscle movement will regain its strength. So the paralytic state will stop, and you'll be able to move your muscles again. And even if you get to the point where the botulism is so far progressed where you're having trouble breathing, I mean, they can put you on supplemental oxygen, potentially even a ventilator, and load you up with the antitoxin. And again, once that antitoxin neutralizes all the botulinum toxin, you're going to start to be able to move again. Your lungs will start to be able to take in oxygen again. So even if it progresses to that point, individuals can still make a full recovery. The only cases where it's obviously fatal is if you're not able to get to a medical facility in time to get the antitoxin. At that point, it could become fatal because it affects respiratory, which you can only sustain respiratory failure for so long before you would die. So at that point, it could be fatal. But ideally, you would get the antitoxin before you got to that point. As far as prevention, one of the biggest preventatives is properly sterilizing at-home canned foods. So kind of the standard for sterilization is 121 degrees Celsius for 15 minutes, but to ensure it, you go an extra 15 minutes. So we would still do the 121 degrees Celsius, but just to be extra cautious, we would do it for a 30-minute cycle in the pressure cooker. And at that temperature, you would be, even if the endospores were present in the can when you put it in the pressure cooker, at that temperature for that period of time, you would be able to effectively destroy them. So it would not become problematic, and they would not be present afterwards to produce the neurotoxin. And then obviously with cases of infant botulism, that can be prevented by not giving babies under 1 year of age raw honey. Now, botulism obviously sounds horrific. I mean, we don't ever want to put something in our body that could potentially lead to paralysis and ultimately death if we don't get the antitoxin in time. But the botulinum toxin is somewhat unique in the sense that it can actually be used to benefit individuals with certain conditions. So it's actually been used medically since the 70s. It has been FDA approved for a variety of different diseases. Please understand, this is the botulinum toxin at very diluted doses. So it is when you get injections of the botulinum toxin to help with some type of disorder or as a cosmetic procedure, you are getting injected with a very diluted amount of the botulinum toxin. But where it's very beneficial is in diseases where people have a hyperactive muscle disorder. So in conditions where you are prone to spasms, muscle spasms, if you get injected with a low dose of the botulinum toxin, it can counteract those muscle spasms and actually lead to relaxed muscles. It's not a permanent fix. Eventually your body will filter out the toxin, so usually you do have to get re-injected initially about every 3 months, but as you kind of build a tolerance to it, that can speed up to about every 4 to 6 weeks. But it's been used to help individuals with migraines, cervical dystonia, which is individuals who have essentially muscle spasms in the neck region. It can help there as well to kind of relax those muscles. You probably heard that it can be used cosmetically. This is where you hear something like Botox injections, where the botulinum toxin is injected into the face, and it relaxes muscles to allow for a smoothing of the skin and reduce fine lines and wrinkles. It's been helpful for sweating, urinary incontinence, all different types of things. So as bad of a toxin as it is, when used appropriately in a very diluted form, it can actually be very beneficial to help with various different medical disorders.